Have you ever opened your mouth and heard a weird click, pop, or even felt it get stuck? That sound or feeling could be your temporomandibular joint, or TMJ, having a problem. Here is the anatomy of the temporomandibular joint. The picture on the right shows the muscles involved, which are the temporalis muscle on top. Below that one is the masseter muscle. To the left of that is the digastric muscle, and below the digastric muscle is the upper and lower lateral pterygoid muscles.
The skeletal anatomy of the temporomandibular joint is seen on the left, which contains a disc, the temporal bone, the condyle, some nerves, and even the ear canal.
So our first injury is the temporomandibular joint disc displacement. It is a common injury that happens when the small articular disc inside the jaw joint moves out of its normal position. When this disc is out of alignment, it disrupts smooth jaw movement, and it can cause pain, clicking, or even locking of the joint. There are two main types, with reduction and without reduction. For with reduction, the disc slips out of place with the mandibular condyle moving anteriorly, but moves back when the jaw opens, which usually causes a clicking or popping sound. For disc displacement without reduction, the disc stays out of place with the mandibular condyle positioning posteriorly and doesn't return, leading to jaw locking or limited opening. And this picture on the right shows the two different types of disc displacement. As you can see, the one on the left, with reduction, the mandibular condyle is positioned anteriorly, while the one on the right, without reduction, is positioned posteriorly. And this condition can be caused by a few different factors. Bruxism, or grinding and clenching of the teeth, can stretch the ligaments that hold the disc in place. Another is jaw trauma, which a blow to the face or whiplash can shift the disc out of position. Overstretching, such as opening of the mouth too wide while yawning or during a dental procedure, can also lead to disc displacement. Other causes include joint hypermobility, when ligaments are too loose, and muscle imbalance, where uneven muscle tension pulls the disc off track. And the most common symptoms are clicking or popping sounds when the mouth opens or closes, pain near the ear or temple area, and sometimes jaw locking. Individuals might also experience headaches, earaches, or notice that their jaw moves unevenly when the mouth opens. For the treatments, most cases of TMJ disc displacement can be treated without surgery. For conservative options, it includes resting the jaw, avoiding wide mouth movements, and using NSAIDs or muscle relaxants to relieve pain and tension. Physical therapy and behavioral therapy can also help, as physical therapy can help strengthen and stretch the jaw muscles, while behavioral therapy helps manage stress and reduce jaw clenching. For more serious cases, there is arthrostenosis, which may be used to flesh the joint and reduce swelling, arthroscopy, which is a minimally invasive surgery that repairs or repositions the disc, and in severe or chronic cases, open joint surgery might be needed to fix or remove the damaged disc. For the picture on top, it shows a video of TMJ exercises for pain, and on the bottom, it reveals a part of how an arthroscopy procedure is done.
The TMJ dislocation happens when the head of the mandible or lower jaw slips out of its normal position within the joint. There are main two types of TMJ dislocation. The first is anterior dislocation and the second is chronic or recurrent dislocation. In the anterior dislocation, the condyle, which is the rounded part of the jaw, moves in front of the articular eminence and gets stuck. Because of that, the person is unable to close their mouth, so it stays open. In the second type, which is the chronic or recurrent dislocation, this one happens repeatedly and is usually due to weak ligaments or a loose joint. Some common causes of the TMJ dislocation may be when someone opens their mouth too wide, injuries or trauma to the chin or jaw, having a shallow or flat joint surface, weak jaw muscles, or even neurological conditions like seizures or Parkinson's disease. And some symptoms may include having trouble to close the mouth or pain around the TMJ area, drooling or slurred speech, and the jaw appears to be pushed forward or to one side, and muscle spasming around the jaw may also occur. As for treatment options for the TMJ dislocation, treatment options vary depending on how severe the dislocation may be. One common method is manual reduction, where a doctor will gently move the jaw back into place by putting pressure inside the mouth. And some medications may also be used, such as sedatives or muscle relaxants, benzodiazepines like midazolam, and pain relievers like ibuprofen. And there are some conservative treatments, such as physical therapy to help strengthen the muscles around the joint, and Botox injections to relax overactive muscles and to reduce the risk of future dislocations, or even autologous blood injections, which can help stabilize the joints. And so, if those don't work, there are also surgical options, including emectomy, where the articular eminence is removed so then the jaw cannot get stuck again, capsular plication, which can tighten the joint capsule to limit any excess movement, and bone graft fixation, where a small bone plate is placed to stop the condyle from sliding or moving too far forward. So while TMG dislocation can be painful and hard to deal with the right treatment, it can be managed pretty effectively.
And that is all. Thank you for listening.